Shock. Shock is nothing but combination of hemodynamic parameters. So you know those are the hemodynamic parameters like mean BP is less than 60 millimeters of mercury, systolic BP less than 90 millimeters of mercury. So there are three parameters: blood pressure, clinical findings, abnormal lab values. Okay. So mean blood pressure less than 60, systolic blood pressure less than 90 millimeters of mercury. What are clinical findings? Clinical findings, there is altered mentation. Okay, patient may have low mentation, drowsiness, then decreased urine output. There is a decrease urine output because of there is hampered renal perfusion as there is decreased glomerular filtration rate. So urine output is decreased because of hypoperfusion. Okay, now abnormal lab values like lactate, increase in lactate, metabolic acidosis. You know that whenever there is decrease in blood supply to the periphery, there is decrease in oxygen supply, hypoxia there. So the metabolism is anaerobic metabolism. So end product of anaerobic metabolism is serum lactate. Okay, serum lactate, and because of lactic acid there is acidosis. So these are the things which occurs in shock. So you know hemodynamic patterns associated with septic shock, specific types of shock. So we know that there are different types of shock, like we know that there are different types of shock, like cardiogenic shock, then hypovolemic shock, distributive shock, obstructive distributive shock, obstructive shock, like pulmonary embolism. So cardiogenic shock, what happens in cardiogenic shock? Actually, there is decreased contractility or decreased EF because of any reason. The cardiac index is low. Here cardiac index is low. Systemic vascular resistance is quite high. Central venous saturation is low. Right atrial pressure is high. Right ventricular pressure is high. There is cardiogenic shock. Cardiac failure is there. So most of the pressures are on higher side. If you go to hypovolemic shock, if you have hypovolemic, cardiac index is low, cardiac output is low, systemic resistance is high, then you will see central venous oxygen saturation will be high because there is hypovolemia, there is no blood. So most of the pressures, right atrial pressure, right ventricular pressure, pulmonary artery pressure, pulmonary artery occlusion pressure, all these pressures are on lower side. Okay, so now what is distributive shock? So you can see what is distributive shock. So like septic shock, there is vasodilation, anaphylaxis is there. If you go to the cardiac center, it has no more effect on heart. It will affect heart only at the end stages. But in distributive shock, because of vasodilation, this pressure, that is systemic vascular resistance, will drop. There will be vasodilation and the blood pooling will be there, blood status will be there, and that will be the reason of hypotension or shock. So all the other parameters like right ventricular pressure or right atrial pressure, right ventricular pressure, right pulmonary artery pressure, pulmonary artery occlusion pressure, all these are to normal, otherwise it will go down, right? Now what is obstructive shock? Obstructive obviously says that there is somewhere there is obstruction into the pulmonary arteries, and mostly because of the obstructive shock is most commonly because of it is because of pulmonary embolism. So cardiac index is obviously decrease. Okay, systemic vascular resistance, there is no more effect. There is increase in peripheral vascular resistance. Then right atrial pressure will be increased, right ventricular pressure will increase, and then again right atrial pressure will increase. So these are the changes which occur in different types of shock. You can go through this one. Okay, now so we have already seen what are different types of shock as we talked about. So different types of shock, like cardiogenic shock. A cardiogenic shock, there is decreased ejection fraction. There is because of any reason, myocarditis, myocardial infarction, cardiomyopathy. So ejection fraction is decreased, heart is failed. So it will end up in cardiogenic shock. Hypovolemia because of trauma, because of third special losing, because of dehydration, loose motions, nausea, vomiting, etc. Whenever there is decrease in blood volume, patient may land in hypovolemic shock. Septic shock, we know that whenever there is sepsis, the pathophysiology is the toxins act on the blood vessel, there is exudation, there is vasodilation, there are release of cytokines, and ultimately, So patient loses fluid and because of vasodilation and transudation or shift of the fluid to the other compartment, patient may land up in shock. Anaphylactic shock, the mechanism is same, and there is vasodilatation. It may also affect heart. There is interleukins, loss of fluid. So patient may land up with anaphylactic shock. So other different causes of shock are explained, like spinal shock. The sympathetic block is there, so patient is dilated. When there is spinal trauma, patient may land up in adrenal insufficiency, also causes shock. So typical features of Addison's disease are knuckle buccal pigmentation with hypotension. Pulmonary embolism is obstructive shock. We already discussed cardiac tamponade. It is also a pericardial tamponade or constrictive pericarditis like situation is there. Okay, so patient there is one triad you may remember, that is called as Beck's triad. Okay, the Beck's triad is your engorged neck veins, then muffled heart sounds, and ultimately hypotension. Okay, so this is the Beck's triad. Other, because of right ventricular infarction, there is also shock. So these are other causes of shock. Okay, so in short, we have seen what is shock, what are the different types of shock, what are the parameters are affected into the shock. Okay, so this finishes the shock. Thank you.